Hello and welcome to the first audio GRACEcast on the topic of complementary medicine. I am Dr. Jack West. I'm a medical oncologist at Swedish Cancer Institute in Seattle, Washington, and I'm also the president and CEO of GRACE, the global resource for advancing cancer education. I'm here with Dr. Patrick Bufi, who is a naturopathic physician, one of the faculty members for GRACE, and works at Swedish Cancer Institute as well as the Northwest Natural Health Center in Seattle. A transcript as well as a PDF file with copies of figures associated with this program are available at www.cancergrace.org/GRACEcasts. One of the common questions that I get is about what patients can do for themselves to improve their cancer outcomes independent of chemo and radiation or surgery. What can you tell them about things like diet and exercise that might help them?
Well, let's see, I like to begin with, I tell them a couple of things, but I really like to begin with where they're at with regards to fresh fruits and vegetables, saturated fats, whole grains, and things like that. If you look at the USA food pyramid, it's kind of the opposite of what we refer to as the Mediterranean pyramid. You go to different parts of the world, you see that they're eating entirely different. And I recommend the Mediterranean food pyramid. For starters, they have about 1/4 the amount of red meat on it, and they have a much wider variety of carbohydrates, and they include fresh fruits and vegetables in every meal, not just one. So I start with that. I encourage exercise, of course, and it doesn't have to be a lot of exercise, even something mild. A nice brisk walk on a daily basis counts. Anything to get the cardio going a bit, or walking fast enough so it's hard to carry on a conversation for a friend. That's where I like to begin, is basically being sure they're not getting too much red meat and increasing fresh fruits and vegetables and moving around, getting out there and doing stuff.
A lot of patients also ask about vitamins and hope that maybe taking more vitamins can improve the way that the chemo or radiation perform. What do you tell patients about taking a multivitamin or potentially several separate vitamins and minerals, both when they're on treatment as well as when they're off of cancer treatment?
Well, this is where the internet kind of gets a little scary, because there's a lot of people out there fishing and trying to do the right thing. But oftentimes they're megadosing some vitamin that they heard about or read about, and in some way it's interfering with the chemotherapy and or radiation treatment that they're receiving for their cancer diagnosis, and they don't even know it. And it could even be in cases where, like for example, high doses of vitamin C, not only as an antioxidant, but it could be in cases where it increases side effects like mucositis, sores in the mouth, and things like that. Where we really need to focus is a high-quality multiple vitamin that has been screened for microbials. It's low for microbials, so we don't put any more challenge and strain on the immune system. Cancer treatments can play havoc with the white blood cells. We know of this. And also a multivitamin that is 100% of the daily value, and no more and no less. That way, we're sure to be under the radar, if you will, of some types of chemotherapy and all types of radiation therapy. So if we're at 100% of the daily value, and we're not having a multivitamin that's loaded with minerals that say 3,000% of this and 600 of that, and so on, then we know we're not getting in the way of treatment. And that is one of the main goals for using supplements during treatment, is to be sure that we're keeping patients strong and healthy without interfering with the treatment that they're getting. And then afterwards, when they're finished with treatment, then we have a much bigger window of opportunity to do things, and then we can work on repairing healthy cells that got hit along the way.
What about any recommendations for family or friends who are concerned about their own risk for cancer? They're not on treatment. Anything that we can say meaningfully about reducing risk of developing cancer down the line based on diet, exercise, vitamins?
Well, a big key to this nowadays is we're finding that more and more people, both genders, are deficient in vitamin D, particularly in the northern latitudes like where we're at here in Seattle and things like that. And I always recommend a vitamin D supplement now, especially in the winter months, at least in the winter months, for everyone. Also, if you look at essential fatty acids, the omega-3s in particular, those have been pretty much stripped out of our food chain for the sake of shelf preservation and being able to keep foods on the shelf forever. And we really need those, especially children, again, for neurological development, brain and spinal cord. Essential fatty acids are also real good for the immune system. They help boost it up. They're good for the liver, good for the skin. So it's important that for prevention, we go there for family members. Exercise, of course, even a little bit, doesn't have to be a big deal. Exercise is something I always recommend for everyone.
Several people have particular questions about naturopathic approaches that they have heard about, recommended from friends, or seen on the internet, but there's not always a lot in the oncology literature about some of these. For instance, can you tell us anything about resveratrol?
Well, it's a powerful antioxidant. It has been around forever, of course, because it's in the skin of grapes, particularly red grapes, so you'll find it in high quantities in red wine. And that is why one of the advantages to red wine as far as the antioxidants, aside from the platelet effect that it has for thinning the blood out in layman's terms. As far as literature, it hasn't really been studied well. I don't know of any human studies. There's a lot of anecdotal information out there on it, which has its place, I suppose. I think in the long run, we'll be hearing more and more vibrato about it and have to just find out how promising it really is.
You're not recommending it at this point for patients?
No, I don't.
Another topic that I've seen a lot of on the internet, not very much in the oncology literature, in fact, I don't think anything I've seen in the oncology literature is on low-dose naltrexone. What would you tell somebody who asks about that in terms of recommendations or any information out there?
Well, I looked into this a couple months ago, actually, and I think it was introduced in the early 80s as a type of therapy for opiate addiction. Consequently, some researchers found that it has some effect on the immune system, and then they started using it for various types of leukemia cancers. And I'm not sure how much luck they had with that. I don't go anywhere that hasn't really been evidence-based and something proven. I don't recommend that to patients. I'm a real stinker about that one. But another angle here, though, is if it supposedly stimulates parts of the immune system, the possibility exists that it could, since the immune system is basically compartmentalized like different rooms in a house, possibility exists that it could overstimulate areas that you don't want to.
Well, you bring up an interesting point, and that is a lot of patients come in with a list of things that they're taking for immune stimulation, and some of these don't have names that I would recognize, and they're just random things. Is this a setting in which immunostimulation is not necessarily a good thing?
Absolutely, especially with blood dyscrasias and types of marrow disorders. That's the first thing I'll do is when I see a diagnosis like that, I'll be sure that they're not doing anything to stimulate their immune system. And there's been some horror stories on that where even with bone marrow transplants that have gone sideways when they should have worked out. And that's because somebody was taking an herb or some type of immune stimulant that really interfered and things never worked out, and they should have. Another angle to that, too, is that herbal products, a lot of which can be used to stimulate the immune system, it being a plant-derived, it could also have mold and fungus on there if you're not sure of the source. There's a whole other problem for the immune system. So it can get a little dangerous out there.
Quite a few of my patients have been taking mangosteen juice. Others ask about noni juice. Certainly some claims out there about anti-cancer properties and potential relevant clinical benefits, but again, it's nothing that you'd see in the oncology texts. What do you tell patients who ask about this? What do you recommend with regard to things like mangosteen juice and noni juice?
Well, if they're not on any treatment, then I'll say go for it. You know, be careful with it, though. A lot of people tend to go overboard. They think more is better when in reality less is more. Particularly with the fact that these products, aside, the good side is they're loaded with antioxidants, which is great as long as you're not on any treatment or it could interfere. Again, we need to stay under the radar for that. But they're also loaded with sugar. That's a downside. A lot of these juices are loaded with sugar, so you got to be careful with that. They're also usually multi-level marketing, which, you know, I don't even go there for my own reasons. A lot of these products also are associated with terms like miracle and secret, and I run from those terms as well. If a patient's in treatment, I won't let them take any of this kind of stuff at all. And also, there's reports of class action suits because of some of these products due to the fact that they've caused liver and kidney damage. And my guess is that is because people have really used them a lot more than the manufacturer recommended.
I've actually had a couple of questions on the website just recently about melatonin as an anti-cancer therapy potentially combined with chemo. Have you seen, are you aware of anything of potential value as a therapeutic benefit for melatonin in cancer?
Well, what I've heard basically is that it acts as a estrogen competitive receptor, competitive inhibition, receptor blockade. And that makes sense. However, melatonin itself, as we know, is a hormone from the pineal gland, and a lot of people use it for sleep. But I don't really like having patients take any kind of hormones. And if they take too much melatonin, then for sleep, for example, they wake up with this monster headache too, so that's a problem with that. I have heard about melatonin being used. I just don't think we know enough about it yet. If I have a patient come in and they're taking melatonin to help them sleep, I pull them off it and I say, look, there's a lot of other ways we can help you sleep, and this melatonin's a hormone. You have a cancer diagnosis. I prefer you didn't.
Thank you very much, Patrick. I really appreciate taking the time.
Anytime. It's been a pleasure.